we're going to be brief, but we felt that it was important for you all to have a sense of what's going on, what we're doing. When, as Kim said, when we were going through it as a family, it was much earlier in the development of the organization. There wasn't as much support then. And there's a lot more happening now. So it's important to recognize what's going on your behalf in terms of advocacy, education, research. And I can only speak from my perspective, although certainly I work with the families a lot. Having that sense of isolation when you're dealing with a rare disease and you have doctors that don't know, anything about it. You're struggling to find specialists. You want to know answers about the research and what's being done. So we really just want to give you a sense of you're not alone. And there are people that are advocating for you, and there are things that are being done, and things are moving along more than they've ever done in the past. We're at a really significant point in terms of what's happening. So just a little bit of background about the coalition. The founders, Dorothy Traynor Kingsbury and Dr. David Robertson. Dr. David Robertson is one phenomenal gentleman. He just retired from Vanderbilt University this past year, and a presentation was actually made to him in recognition for his accomplishments in the work of MSA. So here he is, a doctor and a researcher in the field that was working on developing an advocacy organization. Don Summers, whose wife passed away of MSA, was the first president, and it became a registered charity in 1999. So it started actually as a small grassroots organization, holding support group meetings, gradually built to a small annual conference. Now they're rather large annual conferences. Then the website was established to get more information out, and the Facebook pages. Became a 501c3 in 2004. And then in the last 7-8 years, a lot's been happening, really exploded. Became the MSA Coalition and developed the 4-pillar mission, which I'm going to talk about each one of them. The new website was developed, and then the Scientific Advisory Board and the MSA Research Grant Program was developed. So a lot, as I said, in just recent years has really been happening. The Patient Caregiver Conference moves around the country and now has expanded from that small grassroots organization to anywhere from 150 to 175 attendees, and it's been growing each year. So we anticipate that will continue to happen as the word gets out more, as there are better diagnoses and families know what they're dealing with and come out to get more information. Expanded board of directors. So again, started with this very small group. It ran with like 4 or 5 people. Now we're talking about numbers in the teens of a mix of talented individuals that bring different expertise to the table to give their time. Right now it's run by strictly volunteers. We're leading global advocacy efforts, and I'll tell you a little bit more about that in a moment. And then some new research directions, and you heard from Lucy about a number of the things that we're already involved in. So, a few pictures of the pioneers. In this picture, we've got David Robertson, Judy Biedenheim, the prior president, Don Kraus, our vice chair, and one of our early board members. Vera James, a lot of you must know Vera James because she was really, really active on the support hotline for a long time. Vera is 4th one in, right here in the center. Okay, here she is. Don Summers, and then here's Don Kraus presenting to David Robertson this past year, this fall. Again, David Robertson, a phenomenal, just true Southern gentleman, brilliant man, and such a compassionate man, and really did so much to get this organization off the ground. So our 4-pillar mission, supporting patients and caregivers, educating patients, caregivers, and healthcare professionals, financing and encouraging research, and advocating for important issues. So just to give you some background, and this is going to also be posted with the material at the site that Kim mentioned, to give you just a breakdown of how the funds are being spent. And you can see over this period of 2013 to 2017, the majority of funds are being spent on research. don't be alarmed by the fact that it's gone down a little bit here for 2017. I'm going to tell you a little bit more about research as well, but we are taking a new research direction, and we started with funding these seed grants. And we're now looking at going to the next level and further developing some of these projects and contributing. So we're redirecting a little bit. And Dr. Vic Corona out of Boston is phenomenal and is really working hard to lead those efforts and working with researchers and building collaborative efforts, including the Kaufmans. So, and then patient support and education. So those are things like the annual conference, the materials that we disperse, education of medical professionals, conferences, again, that we host for them. We're sponsors of a number of different conferences that help to educate medical professionals, and then various awareness activities. So for support, you've got the toll-free support line. We have mostly people such as yourselves, caregivers who've been in the position, that work on the support lines that can really speak from experience. And Judy still helps out with the support line, even though she's an emeritus member now, and Judy's a nurse as well. So she's not only a caregiver, but a nurse, and got some good background there. We've got lots of online forums. Shai Drager, the Yahoo group, is still active. We've got multiple Facebook groups. And then the annual conference, as I said, it's been growing. It's moving around the country. And then there are support groups that we do have information about posted at the site. Some of them are hosted in collaboration with coalitions, some of them with organizations such as ourselves, some of them with a partner organization, Cure PSP. So there are different groups, and we have a listing of all those different groups around the country. In terms of education, as I said, the annual conference, there's some great information online at the MSA Coalition website, what you need to know, as well as other web-based resources. That What You Need to Know document, has everybody taken a look at that document? Are you all familiar with it? It's a really, really comprehensive document about symptoms and information that you really need to know. We encourage you to download it. We encourage you to take it with you to your doctor, right? So that's something that would really be helpful for you. Bring it with you. Healthcare professionals, a lot of CME programs. The Milwaukee conference, there was one that was connected to the Patient Caregiver Conference. Dysautonomia International was sponsored in part by the MSA Coalition. Again, these different groups, the Autonomic Society, the Robertson Symposium, that's in honor of David Robertson being held in Vanderbilt, but it's another medical conference. It's coming up this year. Lots of meetings. So the past two international MSA congresses, the MSA Coalition was a significant sponsor, exhibits at these different organizations. So we're trying to really do a lot to help expand the medical professional knowledge. It's going to take time because it's not just about the specialists, it's about the neurologists, it's about the primary care, it's about the nurses, it's about the therapists, it's about the EMTs. I mean, there's a lot of people that have to be educated, and it's going to take some time. But we're working on it. We're doing what we can to try to help build that education. Here's some of the pictures from some of the last conference, people attending from the coalition. Right. Some of the educational and international, that was in Milwaukee. The educational conference there, that was with our Cure PSP partners. It's Trish Corona, Pam Bauer, Alex Klein, great people. Can you make it? The annual conference is moving to the West Coast. This past 2 years, it was more Eastern oriented. We had Nashville, we had New Orleans. Next year, it's going out to San Francisco. I can't help but mention September 28th, 29th. It's an unusual date. It's usually in October. October 3rd, as you may know, is World MSA Day. So we just had some different things happen that were unusual this year in terms of other professional conferences having unusual dates and getting all the pieces into place. So it fell on September 28th and 29th. So what's the big deal about that? That's Mom's birthday. So it kind of felt like, okay, Mom, I guess you want to be in on this one. Lots of advocacy and awareness. And a couple of things not on here, going back a few years as well. Advocating for droxidopa. There was a Capitol Hill movement where we met with congressmen. There was the 2014 Global Roadmap meeting out in Las Vegas. We try to inform people about clinical trials, patient surveys. We're a member of the National Organization of Rare Disorders, Coalition of Patient Advocacy, and the first global advocacy meeting. I'll tell you a little bit more about that, and a lot of you already know about the NICE closing bell, the New York Stock Exchange, and lots of other activities. Okay. So, World MSA Day, proclamations, the candles associated with World MSA Day. This was a conference back in 2012. This was out in Vegas at that meeting I mentioned. Neil did a bike ride for MSA. This is Erin Williams doing a run for MSA, so lots of stuff going on. The first global MSA advocacy meeting brought together about a dozen MSA organizations. The benefit of this is strength in numbers. So these groups came together, and as a result of the global advocacy meeting, we are organizing a committee to work on research and try to share resources and be collaborative. And we have a group forming an MSA global consortium to try to, again, bring strength in numbers and bring our voices and share resources. And then thanks to Don Kraus, we participated in the New York Stock Exchange closing bell. And you can see some of the pictures here, including people from our group right here in New York and New Jersey. This is just a summary of funding for the seed grant programs. You can see that a lot of different organizations, it's really spread out to focus on a lot of different possible opportunities. Again, this will be posted at the site. This was the 6th International MSA Congress closing that Lucy was talking about. And again, this is a recognized organization. So we're here to support you. We want you to know that. Reach out to us anytime.